Impact of childhood vaccination on short and long-term chronic health outcomes in children, a birth cohort study. I've never seen this study before.
18,468 subjects.
Henry Ford, like other institutions, has a bias towards the goodness of vaccines. If the results came back demonstrating that the battery of vaccines was associated with chronic diseases, such a result would be particularly convincing. This could be essentially one of the most valuable studies in the field.
The vaccinated subjects were over 4 times more likely to have an asthma diagnosis.
600% more acute and chronic ear infections.
4.47 times the amount of speech disorders in the vaccinated compared to the unvaccinated.
5.5 times risk.
616% increase. Learning issues, developmental delays, speech delays, language delays.
Amongst the unvaccinated group, there were 0.
There was 0 brain dysfunction, 0 diabetes, 0 behavioral problems, 0 learning disabilities, 0 intellectual disabilities, 0 tics, and 0 other psychological disabilities. None.
It's a big difference.
It's very important that this study sees the light of day.
This is devastating.
This paper should have been rushed to publication on an emergency basis.
We are systematically making kids sick, and not just a little bit sick, very sick.
This may be the most important study that has ever been done, and it needs to be published.
He knows if he puts his name on this, his career is over.
I mean, obviously, really emotional.
Zervo's probably going to lose his job over this.
After a Senate hearing where RFK Jr.'s lawyer, yes, another lawyer, spoke about vaccines, which is totally their wheelhouse of expertise, this video has made the rounds about the so-called Henry Ford study claiming vaccinated kids are sicker than unvaccinated kids. That's the MO of the anti-vaccine movement: evoke fear, stir emotions, and bypass critical thinking and facts. It even features prominent anti-vaccine figures, many of whom have lost their medical licenses or were never medical professionals in the first place. I'm not here for drama and theatrics, I'm here for facts. First, this study was never published in a peer-reviewed journal. That means no outside scientists ever reviewed it. The data isn't publicly available and the methods haven't been verified. Some people are claiming the authors didn't publish it out of fear of losing their jobs. But in science, if a study can't withstand peer review, it's not considered reliable evidence. Sure, bring it to the table, let others review it. Until then, it's not a valid study. Second, the way the study was designed built in bias. Vaccinated kids have more doctor visits and stayed in the health system longer, so there were more opportunities to notice and record medical conditions. Unvaccinated children had fewer visits and shorter follow-up, so fewer diagnoses showed up. That's not proof that vaccines cause illness. It's proof that if you don't see a doctor, no one writes down your diagnosis. And let's think about why vaccinated children might have more conditions picked up. Kids who are vaccinated are more likely to be enrolled in daycare or school because vaccines are often required. That means more viruses going around, which can lead to ear infections or wheezing. It also means more developmental checkpoints, teachers, therapists, or school staff flagging learning or behavior concerns. Children who aren't in group settings and who may not have regular doctor visits are less likely to have those issues documented, even if they're there. Now compare that to actual published research. A Danish study released this year looked at over a million children, comparing vaccinated to unvaccinated. It found no higher risk of autism, ADHD, asthma, food allergies, or eczema. In fact, in some cases, vaccinated children had lower risks. That's peer-reviewed science with millions of kids, not an unpublished report collecting dust. Now, I am all for transparency with solid studies in mind. If we really wanted to study vaccinated versus unvaccinated children in America, a good study would need equal follow-up time, equal sample sizes, similar access to healthcare, and adjustments for school enrollment, socioeconomic status, exposure to pollution, and family health-seeking behavior. Otherwise, you're not comparing apples to apples. You're comparing kids who interact with the healthcare system and education system regularly to kids who don't. This matters because when flawed or incomplete data gets pushed out, it erodes trust in vaccines. And when trust erodes, preventable diseases like measles and whooping cough make a comeback. What do I see clinically as a mom who vaccinates her own children and has many vaccinated patients? Vaccines protect children. That's what we see. We do not see more chronic conditions in vaccinated individuals. So if you see this study being shared, remember, an unpublished report with impossible numbers isn't stronger than published research and clinical observation combined. Follow me for more myth-busting pediatric advice, and if you found this helpful, please share it.